The FDA has approved a new drug to help fight obesity. It's called Zepbound and has the same ingredient as the diabetes drug Mounjaro. It's for weight management in adults with obesity who also have a weight-related health condition like diabetes or high blood pressure. And the drug maker says adults who took Zepbound at the highest dose lost an average of 48 pounds in clinical trials. Well, veterans have selflessly served our country, but unfortunately they have a higher risk of developing lung cancer. Several factors, though, are involved: environmental hazards, exposure in combat zones, and higher smoking rates. November is Lung Cancer Awareness Month, so along with the Veterans Administration, the Lung Cancer Foundation of America is committed to research, treatment, and looking for cures. So joining us now is Dr. Drew Munaki. He's a lung cancer specialist, and Jim Patella's Navy veteran of 18 years and a lung cancer survivor. Thank you so much, you two, for joining us today. And doctor, I'm going to start with you. Once a veteran is diagnosed with lung cancer, what is the first thing they really need to know?
Well, thank you so much for having us. We are always hopeful that our veterans or anyone at risk for lung cancer gets diagnosed early. And once they're diagnosed, we really want to make sure that they find a good team of lung cancer specialists who can take care of them. And by team, I'm talking about a surgeon, a radiation oncologist, and a medical oncologist who works together, and more importantly, knows about the importance of biomarker testing. We've had a game changer in our outcomes with lung cancer because of biomarker testing, which is we send the cancer off to a special laboratory to give us the biomarker report, and it lets us know that, look, there isn't just one or two types of lung cancer. There are dozens and dozens of subtypes of lung cancer, and we have lots of different drugs, and those biomarker reports help us match the right drug for the right type of lung cancer.
And sometimes when people get lung cancer, they hear that and they think it means surgery and chemo, but are there other methods to treat it now?
Yeah, there sure are. Well, first of all, I want to make sure everyone appreciates that our surgical techniques have gotten much safer than ever before. No longer do we have to make big incisions and take out a whole bunch of lung tissue.
Yeah.
We have robotic procedures that can just go in and patients wake up with just a few Band-Aids. We just take a little bit of the lung tissue out and people can go home within 1 or 2 days. Next, when it comes to radiation therapy, we no longer have to treat a big area. We have really targeted, precise treatments, and sometimes it can be a substitute for surgery in patients whom surgery might not be, for them. And then again, when it comes to the drug therapies, in the past we just had chemotherapy. Today we have immunotherapy and these targeted therapies, some of which come in the form of daily pills.
Awesome. Amazing what modern technology can do. And Jim, I'm going to turn to you now. You are a Navy veteran and an 18-year lung cancer survivor. Can you tell your story really quickly?
That sounds good.
Sure. I was diagnosed with lung cancer in 2005, and I was diagnosed at a latter stage. So I had to go through a very invasive lobectomy where they removed two lobes of my right lung, the tumor, and then followed up with chemo and radiation therapies. I mention that because the treatment for lung cancer today is drastically different than what I experienced back then. And the ability to detect it earlier when the actual tumors are smaller makes for probabilities of treatment being a lot less and invasive or even painful.
Wow, wow. What would you tell other veterans who maybe are former smokers, who maybe feel guilty? I mean, what would you tell them? Because I know that morale is just so important in this time in their lives.
Well, lung cancer, anybody that has lungs can get lung cancer. And it's not the single result of smoking in most instances. It's a combination of risk factors like toxins, burn pits. In my generation of service, it was Agent Orange, or even radon. In addition to cigarettes, it just culminates in a higher probability of getting lung cancer. But it's not just smoking. And you didn't do this to yourself. If you've got lungs, you can get lung cancer. What I would suggest is that you get screened regularly. It's an investment of 2 minutes of your time once a year to get a lung cancer screen, a CAT scan, to screen your lungs so that if a cancer is being developed, it can get caught early.
Okay, thank you so much, Dr. Drew and Jim, for joining us today. And if you want to see this interview again, you can visit our website, fox2now.com. Thank you, gentlemen.